Hello, everyone, and welcome. Thank you for joining today's webinar. I'm Dr. Kelly Heim, and I'm going to start by introducing our two speakers, Leslie Bonci and Roberta Anding. And today they will present an evidence-based, practical, and up-to-date review on vitamin D and vitamin D personalized requirements, as well as the benefits of vitamin D in sports and exercise applications. Just to give you some information about the accomplishments of these speakers and their specialties, Leslie Bonci is the owner and owner of the nutrition consulting company Active Eating, and she's also a co-founder of Performance 365, and that's also a sports nutrition consulting company. She has worked as nutrition consultant for the Pittsburgh Pirates, Toronto Blue Jays, and Carnegie Mellon University Athletics. Leslie has worked as a sports dietitian for the Pittsburgh Steelers for 24 years and has also worked with the NHL's Pittsburgh Penguins and MLB's Washington Nationals. And she's also been the company nutritionist for the Pittsburgh Ballet Theater, the LPGA, and WNBA. So she has a lot of experience in professional sports dietetics, and she's currently a sports dietitian for the Kansas City Chiefs. Our second speaker is Roberta Anding. She is the clinical and sports dietitian for the Baylor College of Medicine corporate programs team. She's an assistant professor in the Baylor College of Medicine Department of Orthopedic Surgery. Roberta is also faculty at Rice University, where she serves as a sports dietitian for the Rice Owls. And she's currently the sports dietitian for the 2017 World Champion Houston Astros MLB franchise and the former dietitian for the Houston Texans NFL franchise, as well as the Houston Ballet. So without further delay, we're going to get started just in a quick moment. I'm just going to go over a couple of things that I hope you'll get out of today's presentation. Leslie and Roberta will translate the most up-to-date research and give you some key information on vitamin D requirements in athletes, as well as help you understand what vitamin D does, who needs it most, and what it can really do for an athlete's wellness, health, and performance. And if you're curious about your own vitamin D requirements or those of your athletes, check out the vitamin D scorecard, and that can be found in the handout section of the control panel on your screen. So that scorecard is designed to help you understand what your vitamin D requirements might be and whether you should consider further evaluation. You can also find a copy of today's slides in the handout section as well. So feel free to download those and submit any questions that come to mind at any point during this talk, and we will get to them at the end. Without further delay, welcome Leslie and Roberta.
Great, and thank you so much for having us. And on behalf of Performance 365, Kelly, you can go ahead and advance us to the first slide. Leslie and I are paid medical advisors for Clean Athletes, and our views are our own and don't necessarily represent the views of Clean Athlete. Okay, so let's talk about the supporting roles of vitamin D. What are our supporting roles? The supporting roles include immune health. And when we think about immune health, I'm going to orient you that your immune system not only has an innate component to it, skin, epithelial cells, but you also have the ability to have what is called an acquired immune response, and that's T and B lymphocytes. So we know it's supportive in immune health, and there's also immune diseases that are out there that have a supporting role for vitamin D as well, including psoriasis, type 1 diabetes, tuberculosis, rheumatoid arthritis, upper respiratory infections. And with these upper respiratory infections, to me, one of the most fascinating things about vitamin D is the immune cells themselves, the macrophages, the T and B lymphocytes, can actually express their own vitamin D receptor. So as need goes up, these immune cells can actually have an enhanced need for vitamin D, and they can upregulate those receptors. Also critically important for health and lung function, there's been a study called VIDA, V-I-D-A, that has looked at vitamin D deficiency in individuals with asthma and other bronchial diseases, and has showed a supportive role for vitamin D in improving lung health. Certainly muscular strength and power is what we're concerned about for a lot of our athletes. And we know that vitamin D helps to regulate muscle growth. It can regulate the differentiation, particularly in fast twitch muscle fibers. And as vitamin D deficiency becomes evident, there can actually be atrophy of those fast twitch muscle fibers. We know of its important role in calcium balance, but if we think about contracting muscle, certainly those actin and myosin fibers have a vitamin D role as well in terms of getting that calcium phosphorus into that muscle cell. And there's also some suggestion in the literature that vitamin D can improve insulin sensitivity. And for those of you who are sports dietitians, we know the improvement of insulin sensitivity is important in getting nutrient delivery into the cell. So we have all of that knowledge in terms of muscular health, strength, and power. Bone density and bone strength are also pretty critical, and this is one of the endocrine functions or the endocrine roles of vitamin D. And so when we think about the roles of vitamin D, it not only has an endocrine function, i.e. bone health, but a lot of the functions that we've described, like immune health and lung health and muscular strength and power, are actually not endocrine functions per se, but autocrine functions. And an autocrine function is a cell signaling function. So there's a turn-on switch there that vitamin D is responsible for. We also know in terms of cardiovascular health that vitamin D receptors are found in smooth muscle, vascular smooth muscle, cardiomyocytes. It's involved in arterial stiffness, and it can certainly lower the risk of hypertension. Did a study with the Houston Texans, and we assessed vitamin D, and 41% of the team was deficient. The worst deficiencies were associated with a higher systolic blood pressure. So we have all these supporting roles of vitamin D. So I'm pretty fond of calling this the head coach. It tells every cell with the nucleus what to do and how to behave. So it's critical in human nutrition, sports, and performance. So when we look at this role, I'm going to orient you to the slide. Certainly there's different sources of vitamin D. We know it is going to come from the sun, and Leslie's going to explore the food sources for us. We can see that it is bound to a vitamin D transporting protein or protein binding molecule. It comes from food, also now gets transported to the liver. And you know from your basic nutrition that there's two steps here. The hydroxylation of vitamin D occurs not only in the liver, but another hydroxyl group is going to be added by the kidney. And fully activated vitamin D can help with calcium and phosphorus absorption from the gut, certainly can help to regulate parathyroid function, and that again is that endocrine. I also want to throw this out to you. Think about what might happen in someone who has profound liver or kidney disease. You would automatically know as those organ systems fail that the activation of vitamin D could be compromised and those folks could have additional issues. So we've got our endocrine function with bone, and our immune system is going to be that autocrine function, that signaling function. We know in pregnancy that when there's a vitamin D deficiency, there's an increased risk of pregnancy-induced hypertension and calcium malabsorption. The pancreas, again, I think is a linchpin here in the fact that there is data out there suggesting, because type 1 diabetes is an autoimmune disorder, that vitamin D deficiency may contribute to the development of type 1 diabetes, because that's the autoimmune form of diabetes. There's also a role, as I said, for vitamin D deficiency in insulin resistance. And so for many of our athletes and our clients that we take care of, I want you to kind of keep this oriented that 86 million Americans have prediabetes, which for the most part is an insulin resistant case. So vitamin D assessment in that population is extremely important. We certainly know that children that have vitamin D deficiencies are small for gestational age, as well as an increased risk of rickets. So again, we can see our sources are coming from the sun, and then food, and then the transport and activation of that molecule occurs liver and kidney. So the essential roles in immune health. So when we think about the essential roles in cytokine regulation, cytokines, as we know, can be, I'm going to say, good players or bad players, and it's really pretty important in just overall immune health. When we look at the deficiency of vitamin D, The statistics are amazing. Over 1 billion people worldwide have a vitamin D deficiency. So you can imagine the impact on immune health as well as chronic disease, in addition to what we're seeing in our athletes. Food in general is a poor source, and supplements are actually more effective than prescription. And so to me, if I'm going to take a vitamin D product, I would rather have a supplement form, because the literature is going to suggest it's 87% more effective than D2, which is going to be the prescription version. The Institutes of Medicine will suggest there's no adverse effects if you stay under 10,000 international units a day. And we certainly know all of the controversy over vitamin D requirements. I'll go through some of the controversy with the Institute of Medicine recommendations for vitamin D and vitamin D blood levels, but the IOM will say no adverse effects for less than 10,000 IUs a day. So for someone who is diagnosed with a deficiency, you could certainly consider 10,000 IUs a day for the first week, and then 5,000 a day to maintain a blood value between 40 and 60. And for many of you, that blood value may seem exceptionally high. But I'm going to orient you to the references down below. There's an article by Grant that has really looked at what would we consider to be more of an optimal wellness blood value. And we're looking at 40 to 60 nanograms per milliliter. We also know that as a fat-soluble vitamin, more is not necessarily better, but given the prevalence of deficiency, we've got more on the deficient side than we do the toxicity. So I think we can look at this and say, all right, vitamin D deficiency, prevalent worldwide, essential in immune health. What is going to be our recommendations for maintenance of normal blood values? So this is a great study by two of our great colleagues, Dr. Annette Larson-Meyer and then Tanya Holliday. And what they tried to do was validate a vitamin D specific questionnaire to determine vitamin D status in athletes. And they not only looked at diet, they looked at lifestyle and how long were you out in the sun during the day? What was your body composition? What was your skin color? All determining variables of vitamin D status, and really found that it was not terribly effective. So as sports dietitians, ATs, strength and conditioning coaches, we always look at assessment, and quite honestly, a dietary assessment, even when it's integrated with lifestyle, may not be the most effective way. So we're going to go back to that need for what is my blood value. So how vitamin D works. So vitamin D in your blood is transported by a vitamin D transporting protein. Some can be bound to albumin, but primarily it's got its own transport protein. It binds with that vitamin D receptor, and then it regulates. It can regulate over 1,000 genes. So again, this is not the endocrine function. This is more the cell signaling function of vitamin D. So any cell in the body that has a nucleus is going to have a vitamin D receptor. That's why we see all these extraskeletal roles for vitamin D, is because it has multiple functions, in part linked by the vitamin D receptor. But I'm also going to give you a little bit of controversy when we're talking about vitamin D across ethnicities. When we look at African Americans, there is something called the vitamin D paradox. And what that means is that African Americans can have lower levels of vitamin D, but they don't have any increase in osteoporotic fractures, bone disease in comparison to their lighter skinned colleagues. So the question has been on the table for years, what is the mechanism here? And so what we look at is, are we measuring the right metabolite of vitamin D in the blood? And again, there's lots of controversy associated with that. Or is there a difference in the quality and the number and the activity of the vitamin D receptor isoform? And so is there something different and unique about African Americans? So we can't say that if you're a vitamin D deficient African American, you're at increased risk of bone disease, because the science doesn't support it. That's the skeletal effects of vitamin D. But when we step away from skeletal health and start talking about other functions, cardiovascular, muscular strength and power, now that vitamin D deficiency is seen in those tissues much more than you would see in terms of bone health. So that vitamin D receptor is important, and again, it's a gene regulator. And I know when Leslie talks about heptadine later in the presentation, that's also going to be an example of vitamin D functioning as a gene regulator. So when we look a little bit deeper at this, vitamin D balances immune mediators. And again, because it's the head coach, it is the CEO, it's going to dictate what that cell does become and what kinds of cytokines it makes. So we can look at things like interleukin-2, interleukin-6, tumor necrosis factor, interferon gamma, and look at these as all more in the inflammatory realm, that they're inflammatory cytokines, and they balance it out with the good guys. And certainly we know in many diseases there can be an upregulation of those inflammatory cytokines. Vitamin D helps to balance that. It helps to balance that and keep that function of the inflammatory cytokines and the anti-inflammatory cytokines, keep them in balance. And so that's why you see so many articles coming out on vitamin D and immune health. Another great reference for you to take a look at is on an article by Dr. Neil Walsh, who really does explore this in terms of upper respiratory infections in athlete health, and how upper respiratory infections are the second leading cause of an athlete going to see the athletic trainer, with injury being first. So illness certainly is impacted, upper respiratory illness is impacted by a vitamin D deficiency, in part because of an overexpression of those genes. So when we look at recommendations, the Institutes of Medicine will talk about it being the recommended blood value is greater than 20 nanograms per milliliter. Their endpoint, when the Institutes of Medicine came up with their recommendations, their endpoint was fracture. Their endpoint was fracture. It only really looked at the endocrine function. It only really looked at bone health. And so the IOM oftentimes gets criticized for being, the value being too low, when it really wasn't too low. It was only looking at one specific role of vitamin D, which was the endocrine function. The Endocrine Society, which tends to be a little bit more progressive, above and beyond the IOM, and certainly above the current DRIs for vitamin D, will suggest a value of 30 nanograms per milliliter. The Vitamin D Society will suggest up to 60 nanograms per milliliter really is our benchmark in terms of blood values. So we've identified that doing a dietary or a lifestyle questionnaire may not be terribly helpful. We've identified the roles of vitamin D, and now we're looking at a blood test. And so doing a dietary assessment, looking at food sources, may or may not give you the complete answer that you're looking for. And so when we look at the summary threshold of this, again, this comes from the IOM, that when you have a nanogram per milliliter of less than 12, so significantly deficient, you can certainly see rickets in infants, children, osteomalacia or bone issues, osteoporotic fractures in adults, and severely deficient. When you're looking at bone health, 12 to 20 is considered generally inadequate for overall health and well-being in healthy individuals. Then we get to 20 to 50 nanograms per milliliter, and it's considered adequate for bone and overall health in healthy individuals. And then we always have to pay attention to adverse effects. And certainly when blood values are 60, 70, 100, I actually had a baseball player with a blood value of 150 nanograms per milliliter. We don't want that either, because then you can end up with calcification of soft tissue. But again, most of our clients are going to be deficient. Toxicity is going to be rare and the exception to the rule. And so now I will turn it over to Leslie Bonci.
Well, thank you, Roberta. And always, every time I listen to you, I learn something new. So Roberta is the smarts, and I'm the smart ass part of the presentation, but going to give you some of the practical application of some of the things that you just heard from Roberta. And so when we talk about this deficiency, and we look specifically at athletes, what are some of the things that we see in terms of the numbers? And one of the things that we know is that we can actually see in basketball players, 47% of US basketball players may have a vitamin D level of less than 20 nanograms per ml. 42 to 80% of NHL players might think, well, why is that the case? And they play indoors, not outdoors, so no sun exposure whatsoever. When we are looking at severe deficiency, or that number that Roberta talked about at less than 12 nanograms per ml, is 32% of US basketball players, 26% of NFL players. So, across the board, and I'm sorry, NFL instead of NHL in the first one, is that this really is a concern, and the rates are going to be higher in those with darker skin tone. Again, as you heard from Roberta, not so much the issue of bone health, but that's not the only thing we worry about with our athletes, is it? We're certainly worried about their muscle health. We are certainly worried about their cardiovascular function. We are worried about immune support. We are worried about insulin sensitivity. All of those types of things are critically important. So it behooves us to really make sure that we are taking a very broad approach when we are talking about how important vitamin D deficiency is. Next slide, please. So then when we look at what those levels are, the recommended serum 25-OHD levels for athletes, again, as you heard, deficient is under 20 nanograms per ml, insufficient is 20 to 30 nanograms per ml, sufficient being greater than 30 nanograms per ml. And I will tell you, when I worked with the Blue Jays, we did have a player who had a level of 7 and was also having significant amount of soft tissue injury through the season until that was able to be corrected. Optimal levels in athletes greater than 40 nanograms per ml, and certainly more is not always better, and more might be incredibly detrimental. So when we're seeing those numbers, I know Roberta talked about an athlete with greater than 150, but certainly even greater than 75 is going to be a problem. Next slide. So keep going. Next one. All right. So when we look at this in terms of the study that Roberta referenced and looking at vitamin D intake in athletes, one of the things that is critically important is we think about, food, right? I'm a dietitian. Food first. It's what we always want to do. And then we have a reality check is, that may not be possible to do it that way. And what exactly is it that athletes do? We can talk about food first, right? We know that people eat every day, but do they necessarily eat foods that are high in vitamin D every day? Well, that remains to be seen, not always. And so in this study, looking at lots of different types of athletes, both in the US as well as abroad, what did it show? So in basketball in the US, and certainly we're having the Final Four coming up very, very soon here, is in general intake of less than 100 IUs per day. When we looked at swimmers who actually had the best of greater than 600 IUs per day, but yes, they were having more than everybody else was, but was that necessarily enough? No. We're looking at male athletes in winter sports, 300 to 400, looking at male athletes in fall sports, 100 to 200 IUs, and then you can see from there, the numbers don't really improve. And so this is why, we really look at making sure that we are taking the broad approach to assessing when there is deficiency and figuring out logistically what makes the most sense to do. Now, that being said, and next slide, as we talk a little bit about food, let's realize this. We all know when you are taking a vitamin D supplement, what are you getting? You are getting the vitamin D. When you eat a food that has vitamin D, you are getting other things as well. So that is why it's not either or, but we're really looking at what is complementary and what helps get somebody to the levels that they need to in a realistic way. So if you look at this slide, first and foremost, be aware of the fact that this is it. It's not pages and pages of list. This is what we are talking about. So let's think about somebody who might have a fish allergy. Well, that kind of eliminates the first 4. things off the list, then tuna would be off that list as well. So that's not going to be practical. Secondly, if somebody truly has a deficiency, they're going to have to eat one heck of a lot of salmon or trout or tuna. And some of those items are pricey. Some of those items are not always available. So there's nothing wrong with eating the foods, and eating the foods also provides some protein. But again, we have to think, does this fit within a price point? Is this something that people actually like and would do? So the top 4 of these items are fish. Number 5 is mushrooms, and it's not all mushrooms. It's mushrooms that when they are grown, they are exposed to UV light. So not every single mushroom is going to be a source of vitamin D. There is some mushroom powder out there that is available as well, that is oftentimes used to add a savory flavor to a soup or a stew or stock. There is vitamin D found naturally in milk, in both whole milk as well as lower fat milk. There's some, but if we say recommendations, getting anywhere from 800 to 1,000 IUs of vitamin D a day through food, that's a lot of milk to consume. Most people aren't necessarily going to drink a half a gallon or more in order to get their needs met. Next slide, please. So one of the things that Roberta mentioned, and I wanted to talk a little bit about, is heptadine. So heptadine is actually a marker of inflammation, and it is sometimes referred to as the anemia of inflammation. The problem is that if heptadine levels are elevated, it can cause further decreases in terms of athletic performance. So having elevated heptadine levels can sequester iron. And there was a study that was done that looked at basketball players and found that when they were rigorously training, that the levels of heptadine actually went up. So how does vitamin D fit into this? Well, vitamin D has a role to play because indeed it may down-regulate that production of heptadine. So another advantage to optimizing vitamin D levels. But we don't arbitrarily supplement. This is why we talk about doing blood work, not only to assess vitamin D levels, but to assess heptadine levels as well. Next slide, please. So looking now at performance, and there have been some studies that have looked specifically at the role that vitamin D plays on performance. And the first one of these actually showed that low vitamin D levels can negatively impact health and training efficiency of athletes. So when athletes are trying to have every possible advantage that they can, and realizing that optimizing vitamin D, it's a pretty easy thing to do in the overall scheme of helping athletes to be the best that they can, it is why it becomes so critically important. And also realizing that those of us who work with athletes, sure, we're concerned about their performance, but as healthcare professionals, we are also concerned about their health. And we want to make recommendations that help athletes to stay healthy for an extended period of time, or decrease the risk of underlying comorbidities, or decrease the risk of injury, or whatever else the effect might be. Next slide, please. So in a study that actually looked at some of the benefits of supplementation, and this compilation from many different areas here, is what types of things might vitamin D help with? It might help with increasing vertical jump, increasing sprint, balance, performance during competition, hand grip, strength, chin-ups, speed, endurance, and VO2 max. Well, all of those really seem to be quite positive, right? What athlete doesn't want to be faster, stronger, and have more energy throughout? Again, this is not to say just take D and call it a day, no longer do you need to practice. It is to say that when we talk with our athletes, and sometimes they tell us the struggles that they're having around certain aspects of performance, that we want to do a deep dive and be able to ask some of these questions and ascertain whether indeed there may be a role in terms of supplementation and also optimizing eating. Again, not either or, it is both of those together. Next slide. So that being said, and when we talk about supplements, and you heard from Roberta and some of the studies that have looked at this, it seems that vitamin D3 really is the way to go. However, it's not one size fits all. The amount of supplementation that we are talking about is going to be contingent upon, number one, blood levels, and number two, looking at particular goals and also what underlying issues may be going on with that athlete. And, let's take into account the food things too. For the athlete that is vegan, it's going to be a little bit hard to get in that vitamin D through food unless they're going to eat copious amounts of mushrooms every day. And some people simply don't like them. For the athlete who is allergic to fish, again, this becomes a challenge in terms of being able to optimize vitamin D through food sources. So, next slide. So one of the things that Roberta and I talked about when we were putting this together is, really some way of assessing, and a very, very quick way of doing this. So if not, oh, I can look at you and tell that you need D, right? We're good, we're not that good. So what types of things can we all do that would be, we could take this ourselves, we could have our athletes do this as well. So one of the things that we want to do is a scorecard, and the answers are yes, sometimes, and never. Most people aren't necessarily going to just check one particular column and it's that across the board. We might have different things that depending upon where we are. So for instance, for the athlete who might have a history of insufficient vitamin D levels, stress fractures, soft tissue injuries, osteopenia, and fat malabsorption that we see sometimes in underlying inflammatory bowel disease and other types of diseases. All right, that might put them at risk. If we have athletes who often use supplements or other modalities to support upper respiratory or immune health, that may be something that we get concerned about. If they have a higher risk of, then they might be at risk for vitamin D deficiency. If they are over fat, so a BMI greater than 30, that's another red flag. If somebody has darker skin pigmentation, yeah, that's not a yes, no, or sometimes or never, right? I mean, it's yes, you do, or no, you don't. So, there's going to be one answer you're going to have. Some of the other answers might change a little bit depending upon perhaps season of the year or what else you're doing. Do you train outside? Do you apply sunscreen? And this is one of the things, and we talk about this as well, is, it's one of the ways our body makes vitamin D is from the sun, but we also know that we want people to be careful about their exposure to the sun because of increased risk of skin cancer, and that means sunscreen. And if somebody's wearing sunscreen, then they're not going to get that same efficacy of being able to convert the passive vitamin D to an active form within the body. Do you consume dairy products every day? And do you consume fatty fish? So depending upon what your score is, it gives you an example of whether or not you may indeed be at risk for deficiency, and that might be a reason then to pursue a little bit more investigation into all of this. So next slide. And as we wrap up and open this up to questions, is we really need to think about the application. Again, as sports dietitians, we want the most comprehensive things we can do. And then also, what's practical? We talk about practicality is also related to, you can give an athlete a supplement that doesn't guarantee they use it, right? So it's really, really important that we make sure that we give those recommendations and give them the reason for why too. We might look at compliance as being another area of concern, and then cost as well. So Kelly, let me turn it over to you.
Thank you, Leslie, and thank you, Roberta, for a wonderful presentation, very concise. I'm going to open it up to questions shortly, and before I do, I just want to bring your attention to Clean D 1000. This is a 25 microgram or 1000 IU product containing that's a one tablet that contains 1000 IU of vitamin D. These are fairly small tablets, so and also a fairly small bottle, so it's great for compliance and putting in your gym bag and traveling with it. Anyone who needs extra vitamin D, this is a very easy fix because it's just, it's just vitamin D. There's nothing else in it. And just like any clean product, it's NSF certified for sport and meets all of our testing and quality criteria. So you have that option at your fingertips. And here's some references. Again, I just want to remind everyone that these slides are available for download in the handout section of the control panel on your screen. So thank you, Leslie and Roberta. I want to thank everybody who's joining us today. We will start with questions, and I have a couple of questions for both of you, and I'm not sure which one wants to take it. Can you skip days with vitamin D? You know, compliance can be, as you know, can be a challenge. And if people are skipping doses, should you double up on the next day? How do you deal with that?
Well, to me, part of it depends on leanness, right? So if I have someone who is over fat, when they take vitamin D, it's going to be sequestered into body fat and not be available in the plasma. So for my overfat athletes, I really need that vitamin D available in the blood, and I would push for everyday taking, but if they missed a dose, I would probably give them the extra dose. And Leslie, do you have a different thought?
You know what? I think that the best way of improving compliance is to pair it with something else. So it's okay when I'm brushing my teeth, which hopefully most people do every day. And so that's the time that you take it rather than trying to get it in some obscure time when you won't do it. I oftentimes find if you ask somebody to double up the next day, that's not happening.
Yeah.
So you're really trying for what is the easiest thing to do with that pairing makes the most sense. And if you forget one, then okay, when you remember it, take it again, but just be consistent with that same dose each and every day.
Yeah, and I think for a lot of sports dietitians who practice and they provide the supplements and they're providing it and your athlete doesn't show up on Monday or Tuesday, do you give them their Monday and Tuesday dose on Wednesday? And I think that's an issue with compliance as well, right? So sports dietitians can put together all these performance packs and the athlete doesn't show up. So to me, I look at that and think, okay, what I'm going to do is put more of that into storage. And certainly the data is pretty clear. As that athlete loses body fat, their vitamin D levels go up because it's released from body fat and dumped back into the serum. So I'm most concerned about the overfat athlete.
Great information. Thank you. Another question. What about the monitoring interval? How long should you wait before getting retested once you've started supplementing?
Well, I'm going to say from a cost standpoint, at Rice, we do it once a semester. We don't consistently retest. We just don't do that because it becomes cost prohibitive for many universities to do that. I don't know that I would know of an interval. I usually think about somewhere between 3 to 4 months before you would retest. Leslie, do you have thoughts?
I would say shorter than that, you're probably not going to see anything at all. And even in terms of getting insurance to cover it, they're
Right.
not going to do that in that kind of an interval. And then the third aspect is we know how you're going to test for vitamin D. You can do a blood test, and not everybody just jumps for joy to have have blood done. So it's just one of those things is really giving somebody the dangling carrot and knowing that they're not going to be 100% compliant. They're not going to take it every day. They just aren't. So over a 3 to 4 month period of time, if you're getting 70% compliance with it, then hopefully at that point you would see some change in the right direction.
Yeah, very helpful. Anyone else who has questions, please submit through the chat or the Q&A, and we'll get to them. Another question for both of you. We all have busy lives, and sometimes it's hard to get vitamin D, at a meal. So do you really need to take it with a meal? Do you need to take it with fat-containing foods? What are your thoughts on that?
Well, I think Leslie was very practical. It's never going to do you any good if it just sits in your bathroom. And so I think that the data will say you get better absorption, up to 30% better absorption when you take it with a fatty meal. But if that's not practical, if that's really not practical, I would err on, you know what, I just need to take it every day. Because what if your breakfast turned out to be cereal and fat-free milk? Well, you still don't have any fat in that meal anyways, and I don't want people to overthink it. I want to promote compliance, and the simpler it is, the easier it is, the more likely you are to have compliance.
Yeah, I would agree with that too. And taking it is really the most important thing. So even if you're not getting 100% out of it, just taking it consistently is going to be what we're looking for. Yes.
Yeah, that makes sense. Any contraindications? Are there any scenarios where you would not recommend vitamin D for whatever reason?
I think if there was a disorder, I could envision something like hypercalcemia or something along those lines that I don't know. But most of the things that come to my mind would be medical conditions and not performance-based conditions, right? So I don't know that I would say not take it. Now, if you have an athlete who is at 150 nanograms per milliliter, no, they don't need to take it at all. But those, I would think of more of a chronic disease focus and disorders of calcium metabolism might be where I'd be a little bit concerned.
And those are going to be rarer anyway. Those aren't the types of things that we're going to be seeing each and every day. But it also speaks to the point of why it's not one size fits all or one dose for everybody, and really making those recommendations based upon the scorecard, based upon the blood work, based upon the intake, based upon the health history. All of those things are equally important.
Right. And I think that's what sports dietitians are trained to do, right? We're trained to assess not just diet, but lifestyle, training factors, body composition, all of that, and then come up with recommendations targeted to that individual. If you've got blood values, I think that's the way to go.
We have a question about nutrigenomics and vitamin D. Are you aware of genetic markers that inform vitamin D requirements? Do you use any of that information in your assessments?
I don't, because of the financial cost of that. I don't. I would say when you look at the role of vitamin D and all the roles in gene expression, one, you cannot ignore diet and gene interactions. And the best example that we gave today was Heptadine. You can end up having somebody who's iron deficient because of an inflammatory marker. So I don't think it's as easy to say, let's identify one SNP, let's identify one area. We really need to look at this from a comprehensive standpoint. So I'm not an expert in genetics. And Leslie, do you have any thoughts on that?
I am not an expert in genetics, but I think it really speaks to the point of how incredibly complicated this is, and not making it any more complicated for athletes at risk than we need to. It's just basically trying to correct what is wrong. That is what we all should be striving for.
Yeah, and I think the data on African Americans has always been, compelling. Why do you not see bone disease when you have, as a population, much more likely to be lactose intolerant? So dairy can be off the table, but you don't see metabolic bone disease in African Americans. So there must be something about gene expression and that vitamin D receptor that is unique in that population. So the first time I saw that article, it was, I think, in New England Journal of Medicine, 2013. So it's relatively new science. And as Leslie said, I think the interaction, the diet, gene, training interactions are so robust that we need to think simple, understanding that there's probably a lot more behind the scenes that we could learn.
Yes.
Yeah, absolutely. I'll just add, just from the genetic standpoint, that there are a lot of predispositions that are within our genome. But at the end of the day, you're testing blood levels, and those are the most authoritative indicator of what your vitamin D status really is. And at that point, genetics really kind of becomes a little bit of a moot point. It's good to know, if you've never done any serum testing, you don't really know where you stand. If you do have a genetic marker that suggests that you should look further, that's nice to know. I think that the scorecard that you can download from this presentation will give you a better indication overall of your risk. I would rely on that with greater emphasis.
Yeah, and Kelly, to follow up with that, to get genetic testing, because I work with some scientists that were part of the Human Genome Project, to get reliable genetic testing, it's between $3,000 and $5,000. You can't get it with the direct-to-consumer genetic testing. It's not available and it's not reliable. So to me, a lot of it also depends on how are you assessing genetic risk.
Yeah, and the science is still in an early stage. I mean, we know certain markers in genetics that do have something to do with vitamin D levels, and they've been associated with lower vitamin D levels. But a lot of work still needs to be done in uncovering all of the genetic loci that are involved. And so again, blood levels would probably be the way, if you're going to spend money and time, that's where you want to spend it. Another question on vitamin D, the dosage format. So pill versus liquid. Do you have any thoughts on what might be best?
Well, to me, pills are infinitely more convenient than liquid is. The only time I might consider a liquid is if I knew I had an older adult with achlorhydria or something where they couldn't break down a tablet. Then I might say a liquid or a gel cap would be better for that individual. But for a young, healthy adult with adequate amounts of hydrochloric acid in their gut, I wouldn't go with a liquid. I wouldn't go with a liquid. I'd go with a
And
tablet.
certainly when we're talking about an athletic population and why it is that we really feel it's so important to have third-party verification. And think about
Yeah,
that on a supplement too. Is that you don't want any unintended consequences of what it is that you're taking. You want what is in that product to be on that label and call it a day. That's it.
right,
So
right.
this another and again, and I think the convenience is a lot of times with something that you actually have to chew or swallow. If there's a taste issue that goes on, it'll be one and done. Nobody will do it again. And when we're trying to increase compliance, that doesn't help at all.
Right.
So here's another question. After you reach the levels that you want, your vitamin D levels are normal and it's where you want them to be. How do you deal with that athlete afterwards? Like, what is the program after that? Do they have to keep taking the same exact dose forever? How would you recommend, if they're going to be out of your care and out of your hands, how would you advise them for the rest of their lives? Do they have to keep taking the product? I'm sure they ask you that. How
Yeah,
do you handle that?
I absolutely recommend you take it lifelong. I live in Houston and we are outside most of the year. And when I saw that 41% of my football players who played outside because they didn't like playing on turf in the bubble, 41% was deficient. My recommendation as transition from sport and on to real life, that a very safe conservative dose is 2,000 IUs per day. And I recommend that as a lifelong supplement. Again, lots of controversy on how much should you take a day. But when you look at toxicity data, there's no known toxicity at 2,000 IUs per day. And there could be, again, extraskeletal benefits in terms of cardiovascular health and muscular health and performance. And Leslie mentioned it, we want our athletes to be healthy, not just to perform well, but to be healthy lifelong. And so I think the power of a sports dietitian is not only to talk about performance, but what happens with the rest of your life, what's going to happen. So I use 2,000 IUs.
And I mean, if you were, and even then translating that to 2000 is what would that look like from a food perspective? So we're talking 9 ounces of salmon every single day, and not going to happen. Nobody's, even if somebody loves salmon, they're not going to do that. They can't afford to do that. It isn't accessible. They don't know how to prepare it. All those types of things, it isn't practical to be able to get that or even get 1,000 IUs via food alone every day. That's
Really,
more work, right? There's no work. If you take a supplement, open the bottle, take, swallow, done. With food, you have to do a little bit more production.
right.
Yeah, and with vitamin D, if you're taking 2,000 IU for the rest of your life, it's not going to build up in your system and
Mhm.
create a toxicity issue. That was part of the question. I just wanted to raise that because I'm sure it's on people's minds if they're going to be taking something long term.
And I think and obviously sports dietitians, ATs, and strength coaches are evidence-based. When you go to the literature and trying to find a dietary intake level that's going to cause toxicity or a supplement level that's going to cause toxicity, there's nothing with 2,000 IU. That's why IOM saying a dose of less than 10,000 is perfectly safe. So to me, 2,000 is conservative, and they could take, two tablets of 1,000 IUs a day. The pills are small. They're not taking horse pills. And it just becomes, like Leslie said, like brushing your teeth. Part of your daily hygiene.
Yep, good advice. So that concludes our Q&A session. If anyone has a question that they come up with later, feel free to email us. I want to thank our speakers, and I especially want to thank our audience today for joining us. I hope you found this helpful, and please keep in touch with Clean Athlete. Enjoy your day.
Yes, thanks so much for joining us. Thank you.
Bye.